Welcome back to the Daily Drum on WHUR and Sirius XM Channel 141. This is the Insights segment. I'm Harold Fisher. As we come to the end of April and Minority Health Month, we're taking a look at women's health. Now, earlier this month, we had a discussion about Black maternal health, but there are still so many issues to consider. And tonight, we're hearing from the professionals at New Pathway Healthcare and Wellness in Bowie, Maryland. My guests are Dr. Nancy Francois, Medical Director for Primary Health Care, as well as Dr. Chantel Fletcher, Family Nurse Practitioner. She also has expertise in primary care, behavioral health, and medical aesthetics. Also, owner Owen Garner. He is, as I said, the owner of New Pathway Health Care and Wellness. Thank you all so much for joining this important conversation.
Thank you for having us.
Thank you for having us.
Let me start with a fast fact. 15% of Black women and 25% of Latino women have reported of being in fair or poor health compared to 15% of white women. Now, we know this is yet another set of numbers as it relates to health disparities. But I would like to take a bit of a different look at this issue because the disparity issue is not new. Mr. Gardner, how do you believe that this wellness center will address disparities?
I think it will address disparities from looking at healthcare holistically. A lot of times we tend not to look at healthcare as a whole. We tend to look at it in segmented ways. And when you approach healthcare from a holistic standpoint, meaning mind, body, and soul, it gives you better outcomes. And individuals are able to function more practically when they address all healthcare issues, physically, mentally, when I say mentally, from a psychological perspective, as well as looking good and feeling good.
Mm-hmm. And I guess to piggyback on that point, this wellness center is in Bowie. Bowie is one of the more affluent parts of Prince George's County. So some could possibly argue that access and income are not necessarily part of the issues regarding the disparities. So if that is the case, when you look at where the center is, what do you believe are the other factors that could possibly be impacted by the women who come to the center?
When I look at the different aspects, I look at different stigmatisms. As people of color, we tend not to want to address certain healthcare disparities. Certain comorbidities are not. I like to say that, you know, as a man of color, we're quick. I'll spend $70,000 and buy that Porsche car. But when it comes to my health or addressing my weight gain, I tend not to shy away unless it becomes a major issue or a major factor in my overall day-to-day functioning. So I look at it as we tend not to focus on what we should focus on despite socioeconomic status.
Mm-hmm.
Even as a Black man, most individuals, Black men, for example, don't like addressing their psychological needs. It's a stigma. I'm okay. You know, nothing's wrong with me. Unless I'm in major crisis, I'm not going to address the baggage that I walk around with on a daily basis.
I definitely will have you back when you can tell me where you can have that fine a $70,000 Porsche. That's a different conversation. But I think you do make an interesting point as it relates to kind of mindset, which kind of brings me to the point, Dr. Fletcher, of the whole person, as Mr. Gardner was speaking speaking to when you're talking to particularly Black women about their mindset regarding their own health. What are the things that you learn still today that may surprise you about how they see their health? Are they doing what they need to do, or are they neglecting themselves?
I think that Black women are neglecting themselves. One of the issues that I have encountered is, like, Black women will tell me, I have been to this provider and that provider, and they're talking at me, not to me. So they're not listening to my concern. They maybe sometimes they don't understand me, don't know where I'm coming from. And a lot of time they looking for a provider that have maybe the same background, that could understand where they're coming from. It's sometimes taking the time, taking a history, knowing who they are, where they're coming from, and how they approach health. Like, healthcare is very cultural. So if you don't understand the patient underlying condition, their culture, I'm like, we have mother's wife, what's going on into their lives as a whole, you can't really treat them. If you know somebody who's working 3 jobs and you're giving them medication to take 4 times a day, they're not going to take it. So you have to have an idea what's going on with them. You have to have an idea what's they're going through. Sometimes the initial intake will take a little longer, but at the end of the day, you have a better idea who is the patient and how to approach them, and you tailor the care plan for them and who they are.
Mm-hmm. Dr. Florence, I do want to kind of piggyback on what Dr. Fletcher said also, particularly as it relates to your background, because you obviously, before basically practicing here, you've also practiced in the Caribbean. And I'm very curious, when you talk about the health disparities here in the United States, as well as in the DMV, for example, do you find similar health disparities based on your experiences in the Caribbean? Or are they different? And if so, how?
Well, thank you for that question. First, I want to just expound a little on my experience in the Caribbean.
Sure.
Most of my experience has been in the area of practicing health and wellness education on an international basis with a health organization, Hands International in particular, and I've worked with some other organizations. So what we do, we actually do medical missions where we go in and we help communities. And not just the communities, but we help the people in the communities who provide healthcare, educate them, help them to improve their healthcare system so that they can provide more adequate care and use the resources that they do have, which most of the time tend to be less than what we have available here, but be able to use what they have in order to provide the best care to their community. So there are similarities in what you'll see in regards to underlying medical conditions, because a lot of it being cultural has to do with how we eat, and our activity level. Sometimes in certain areas in the Caribbean, you might see people are more active and walking. So if they're in more rural areas, you'll notice that there's less obesity. But the persons in the metro centers, even in those countries, will tend to carry those same obesity-related complications, such as problems with cardiovascular disease, diabetes, high blood pressure, even problems with joints and arthritis because of carrying around extra weight on our joints. And that can be, regardless of male or female, these issues we can see. But when it comes to women in particular, I think that what we're seeing is as women get older, and as we start to transition, especially into that perimenopause and menopause stage, they need more time they need more culturally competent care in order to make sure they understand that transition of life. And so I think that when it comes to the disparities, we see some similarities. There are some differences based on where you live, but certainly it always matters whether the person that's taking care of you, as Dr. Fletcher said, understands you, knows where you're coming from, and can provide culturally competent care. And so in this country versus in the Caribbean, for instance, the difference is that that person is going to look like you more likely and is going to understand you versus here. Oftentimes we're in communities where we don't even have access to physicians and healthcare teams that look like us. And it does make a huge difference. It makes a difference in our willingness to access care. It makes a difference in how that care is perceived. It makes a difference in our ability and willingness to follow the recommendations. Because a lot of times I find that if I'm speaking to a patient and I can say, listen, I understand where you're coming from, sister. I have been there, done that. And they understand that what I'm recommending, I would do it for my own family member. And then they're like, okay, doc, you always tell me the truth. So I'm going to do this. I'm going to take this med, or I'm going to start exercising. I'm going to stop smoking. I'm going to, whatever it may be, they can make those lifestyle changes because they trust you and they understand you really do have their best interest at heart.
And that's specifically why I asked that question, because considering your backgrounds, and talking about Black people and Black health and social determinants and disparities. If I had not, for example, injected your experiences, for example, in the Caribbean, you sound like you're talking about east of the river in Southeast DC. And I think that is one of the things when we look at these critical issues of making access to health care, whether it's in Fairfax County, east of the river, or in Bowie, Maryland, that there are some things that remain the same.
Exactly.
And I think that's one of the pieces that I was getting to, which of course again brings me back to you, Mr. Gardner. What was the reason that you decided to do this in Bowie instead of Silver Spring or Alexandria, for example?
So when I practiced as a healthcare executive for many years prior to opening up New Pathway Healthcare, and when I managed the various healthcare systems or worked within the various healthcare systems, I realized that there was not a wellness center that provided holistic care, mind, body, and soul in the Bowie area. You would have segments or specific specialties that were afforded or presented, but nothing that allowed someone in a safe environment to be able to have all their needs addressed in one specific location. And so, the thought of individuals only seek healthcare when they're sick or when they have issues going on, when they are able to come into a setting such as New Pathway, and for example, they may come in for a facial, for example, and have that conversation with one of the doctors, Dr. Nancy or Dr. Chantel, and they realize, wow, I have so much more going on. It's a lot easier for them to address it at that time, or at least be comfortable enough now to have those issues addressed.
Mm-hmm. That makes sense. In other words, what we often say in the Black church, and you got to get them in so that they can hear the sermon.
Absolutely.
I've got to take a quick break, but Mr. Gardner, is there a website that you want to share with us real quick for those who are interested in finding out more about New Pathways?
Absolutely. You can access New Pathway at www.newpathwayhealth.com.
One more time, please. Is that NU Pathway?
NU Pathway, correct. Thank you for that. So it's nupathwayhealth.com, or you can reach us at nupathwaymedspa.com. So there's two different ways you can reach us.
Well, thank you so much for that. I am going to take a break, and when we continue on the other side, we are going to dive much deeper into issues regarding women's health. So, Mr. Gardner, thank you so much for spending some time with us. We are going to take a quick break. Don't forget, you can hear this in every edition of the Daily Drum Insight segment via podcast on WHUR.com. The original Quiet Storm with Raheem Devon is next on WHUR. I'm Harold Fisher. This conversation continues on Sirius XM channel 141 and 96.3 HD2 in just a few seconds. Welcome back to the Daily Drum on Sirius XM channel 141. I'm Harold Fisher. We continue our conversation tonight about women's health. My guests are with New Pathway Healthcare and Wellness in Bowie, Dr. Nancy Florencois, the medical director for primary care, and Dr. Chantel Fletcher, family nurse practitioner. I want to go back to something that occurred to me, and this is kind of, at least from a layperson's perspective. Everyone, when they're not feeling well, and since we're talking about women's health, let's talk about women. When you're not feeling well and you go to your healthcare center, your wellness center, where your doctor is, and if Dr. Florencois is your primary care, and you're used to seeing Dr. Florencois, but she's not in today, and then you end up seeing, Dr. Fletcher or the nurse practitioner. Explain to me, Dr. Fletcher, how patients can make sure that they have the same confidence in the nurse practitioner that they would have in their medical doctor.
The care that we give is very cohesive, and we do have a medical record as well that we go through. And I will review any patient that have any issue, any outstanding issues. The notes are reviewed, and if there's any issues going on, I will check in with Dr. Florencois to see if anything she would like to be done. And I also check with the patient, reassure them. We all very competent. We go through the care with her and we assure them. A lot of time, patient will come and say, "Oh, I would only want to see that person," and we all do the same work, and we all ensure that the patients are okay. And if they insist, I'll bring them in and I give them the care. And after I'm done, and I ask them, "Do you still want to see Dr. Florencois?"
And the answer is usually no, I'm good.
Okay, do you want to come in my camp? Yes. So we cover for each other. It's very cohesive.
Minus the attitude, of course. Right?
Can I just add, though,
yes, please.
one of the things that sometimes people don't understand is it really has a lot to do with your experience.
Right.
And experience is even more important than what was your original training, because the truth is that Dr. Fletcher is extremely experienced and has many, many years of practice, and that she's experienced in multiple different specialties. And so what she does, she's comfortable with, she's confident in, and she's really able to provide an expertise and level of care that is really beyond what you would get sometimes with a brand new doctor or fresh out of training. So it really has a lot to do with experience. And the truth is, when you get into a niche and you start to be very good at what you're doing, whether it is like Dr. Fletcher with behavioral health and with, aesthetics and with the things that she's doing, she is a pro at it because she's been doing it. And after a while, you can do it with your eyes closed, because you have been doing this so much. Now, don't get me wrong, she didn't close her eyes. But the point is, she is experienced. She's comfortable with what she's doing. She's a boss lady, and I respect her and what she's doing.
And she's a boss lady.
Listen, we got two boss ladies here. We get along and we love each other.
Well, and this, all jokes aside, when you talk about going into a health center, wellness center, what have you, somebody who is taking care of your whole health, yes, it is good to know that the staff have a familial kind of bond, because you want that workplace to be as healthy as you come in there to be. With that said, Dr. Florencois, I did want to ask this because yes, you're a medical doctor, but the center also kind of focuses on wellness. Talk to me about how you blend wellness and those who may prefer natural forms of healing when you know, as a physician, that they actually need much more?
That is an excellent question, and I'm actually really glad that you asked. One of the things that's occurred over the last, I would say, 5 to 10 years in the field of medicine is there's been an acute awareness that the training in medical school is not adequate when it comes to holistic care and wellness. One of the things that has developed over time is a medical specialty called lifestyle medicine. And lifestyle medicine is actually available for physicians, nurse practitioners, and many other healthcare professionals to become board certified in, which I am. And that certification allows you to learn not just what you learned in medical school or in your training, but even bigger picture, looking at the components of health, the determinants of wellness, and seeing that it's more than just, okay, I have high blood pressure, let me take this pill. It's what's the big picture, okay? How is my lifestyle contributing to this? Is there something different I should be doing with my exercise routine? Should I be getting more rest? Is there something different that I should be doing with my stress or stress management? Is there something natural that I can take without having to take medication? And all of this is what can help to improve someone's overall health. But you need to have a physician or healthcare provider who is trained and has actual knowledge of more than just giving medications, but actually understands the whole person and how well-being and wellness integrate into improving your health so you can really thrive. Because the truth is, all you're going to do is survive if you're just popping pills and you keep those same unhealthy habits. You're drinking the coffee every morning because you didn't sleep the night before, and then you're running ragged and your blood pressure is high and listen, I can go on for days about this, but the point is, any example you use in health, our health is much better when you can have a physician, nurse practitioner, or healthcare provider who knows the big picture and can actually help take care of the whole person. What's going on with you at home? What are the things that are affecting your stress levels? Are you a mom and you're, taking care of the kids and having to, run and pick them up and do this, do that? And maybe you're not having time for yourself. What are your self-care habits? Are you in therapy? Maybe there are some unresolved issues that we need to address, and you need to see Dr. Fletcher, or you need to see one of our behavioral health therapists. But a lot of times we don't take all those things into consideration because we really just look at the one problem. But you need a doctor who can look at your overall health. You need a nurse practitioner or healthcare provider who can look at your overall health and then can say, there's more going on here. Tell me more about this. And let's see if we can address this issue by looking at all of the determinants of health and the whole person.
Dr. No, please go ahead.
I just wanted to piggyback also. I know we're talking about women's health, and one of the things that Dr. Nancy just touched on is not always offer the pill right away. And Black men in general don't want to take medication. It doesn't matter how high their blood pressures are. They're like, how long I will be in this. You always have to have an alternative for them, letting them know, hey, we will start this, but eventually with lifestyle changes, we will take you out of this medication. Always a way out, always a way for them to live healthier. So that approach is the office as a whole. We don't want to put patient on medication for the rest of their life. Sometimes you have to, but at the end of the day, lifestyle, that's what we're reaching out for.
Can I just say, one of the things that I do is I never want to start you on a medication without a plan on how I'm going to get you off.
That's
right?
Yes.
Because if all we're doing is just adding pills every single time, it's just going to be one other pill. So if we really do have to initiate this medication, let's have a plan for how we're going to get off of it. And that's a very, very important approach, as opposed to let's just pop another pill.
Yeah, a pill for every ill. So
Well, and so to both of your points, as a Black man raising my hand here, yes, now I don't mind taking a pill if it's going to if I go to see my doctor
mhm.
and, hey doc, this hurts, and my doctor says, well, there's a pill for that, but my question is there an endpoint? How long do I take this pill? Do I take it for a month, or do I take it for 2 months?
Mhm.
And if he says, yeah, take it for 2 months, you can stop it, and that should get rid of it. Okay, I will, give me the pill. I'll take it. The pain will go away, and I'm fine. But I also, and my doctor is wonderful, he will also say to me, these are your options.
Mhm.
And some of those options may not necessarily require medication. It may require a change in diet. It may require an extra day at the gym. It may require heavier weights or lighter weights. It may require more fresh air or whatever. And so I say all that to ask this question, anecdotally speaking, and I'll start with you, Dr. Fletcher. What are your women patients coming to see you about most now over the past year? What are you seeing more of, perhaps, that you did not see a year ago? I mean, is it mental health? Is it is it some of the the diabetes issues, high blood pressure, or is there something else that you were seeing more of? Whatever it is, I'm just curious as to what your experience has been.
To tell you the truth, the bulk of my patients lately have been a combination of older women, not older, in their 40s. I'm selling myself here. 40s, early 50s, premenopause, with comorbidities, with diabetes, obesity, and hypertension. So those are the three that I typically deal with. And a lot of time, it's just kind of finding out where they are, what they've been doing, and what we can do to alleviate their symptoms. And medication is also often for me the last resort. So I always send patient home, do their labs, and see where the labs at, and send them home for a month or two if I can. If they fully hypertensive or they have very high blood sugars, of course you have to treat those right away. But lifestyle changes, yes, I do get women and their stress. A lot of our female stress. I don't know if I mentioned it earlier. We did have something that we call a $40 federal facial. So we had that for our federal workers who were not feeling well. They were very stressed coming in. Some of them would have colds that for weeks that they didn't understand after they were stressed. So we decided, because we have a med spa attached, so we offered a facial that was, I think, over 100, 150 for $40. So they came, and that made them feel better. And a lot of time, you just need to relax a little bit or take things out of your head for a minute and start over. So we look at the whole picture.
And I don't know how things work there, but so are you seeing the same patients? Are you both seeing the same patients, or do you have a different patient load?
We see patients that are assigned. We have patients assigned to doctor, and then patients that are assigned to us. But if patient come in, they could see either one of us. Yes.
So Dr. Florence, while you would agree that some of the same things that Dr. Fletcher is seeing, you're also seeing.
Yes, absolutely. I do think that one of the major things we're seeing in the current political environment, and I will not discuss politics, but I will say that people,
there's been a change in the country. Certainly,
are stressed. Yes, and the stress. So let me get, because I'm a doctor. I'm sorry, I have to get into a little science, a little pathophys here, but
no, that's fine.
Stress is one of those things that has a lot of impact on your health. And so, in particular, the stress hormone, which some of you may have heard of, cortisol, is released in increased quantities when we are stressed. And believe it or not, that actually impacts everything. It is going to impact our hunger cues. And so more stress means that we may be doing more stress eating, more snacking, and we are oftentimes going to see increase in weight, increased hunger. So that also is going to then have downstream effects because that impacts a lot of other areas of our health, including our blood pressure, our cholesterol, our blood sugars, our insulin levels. And even if you're not diabetic, you can be pre-diabetic or have insulin resistance. And so it's all connected, and you can develop diabetes just from a stressful life alone. You'll be like, well, I don't eat a lot of sugar and I don't eat bad foods and I don't eat a lot of carbs, but you're stressed. And let's be honest, you live here in this DMV area, the stress levels can be high. Just driving around the Beltway, the stress can be high, okay? So that's one aspect. But then also we're seeing patients coming in also wanting to work on their weight. So not only is the cortisol going to cause you to gain weight, but it can also cause you to have difficulty losing weight. Yeah. And then add to that, if you're a woman between the ages of 45 to 55 and you're in perimenopause or entering menopause, that weight loss is almost going to be like, it's just not happening for me. As Dr. Fletcher would say, before you could, go out and take a walk, you lose the weight, but then
now you smell the food, you gain the weight.
Smell the food, you gain the weight.
Don't have to eat it.
So our hormones are changing, and that can be an impact. And so for men and women, as we age, our metabolism slows down. Mm-hmm. And so one of the key things that I have been very involved in, and one of the things that I enjoy doing, is helping people lose weight, maintain their weight, maintain a healthy weight, or achieve a healthy weight, because it is one of the top contributors to your health and wellness. And so it may not be that you need to lose weight. Maybe you just have to work on maintaining that weight. But for a lot of people, it is oftentimes that they need to lose weight. It may not be a lot of weight. Maybe you just put on an extra 10 or 15 pounds. Well, most people each and every year are going to gain an extra 5 to 10 pounds. And if you keep doing that every year without working on losing it, over the course of, I would say, about 10 years, you can imagine that is a significant amount of weight. And that is going to be where you see your health take a shift. You're going to see yourself go from, oh, I don't have that many medical problems, I see my doctor once a year, to now I've got this, diabetes, high blood pressure, high cholesterol. Oh, and I had a heart problem. Oh, then now I got a specialist to see. And next thing you know, you're at the doctor every 2 or 3 months, when we could have worked on these things and invested our energy and time into health and wellness to prevent these problems, rather than waiting for them to happen and be reactive. We can be proactive.
So let's talk, first of all, I want to get into a menopause conversation, but I do, since you brought it up about weight loss, Americans are obsessed with it. I don't think that I'm overstating it, from the injectable medications that are available, whether it's Zepbound or Ozempic or the like. There's also been a discussion within the last couple of weeks about one of the pharmaceutical companies working on, I think it's Pfizer, working on a pill. Obviously, that is down the road. But we've had this conversation on this program for many, many years. When you were talking about being invited to the cookout, and I'm speaking literally being invited to the cookout, and all of the things that we as Black people see and eat at the cookout, and the Resurrection Sunday dinner, and we've got Mother's Day coming up, and then we have Father's Day coming up, and then we have and there are, July
4th.
Right. And July, but you have July 4th, but you of course you have winter, spring, summer, fall, and living my best life season.
Yes.
And living my best life season often means, again, eating. And so how somebody comes in and they want to lose weight, how do you explain to them that there is no magic pill, there is no magic shot, that you do have to be an active participant in some of these in some of these issues, Dr. Florencois?
So yes, you're right. Weight loss and weight loss medications, I think right now are at all-time high in popularity. I do believe that obesity is a chronic condition, and it is something to take seriously and to treat and to manage. Not all physicians that you see will give you a nutritional prescription, but believe it or not, there's more than just a prescription for medication. There's a prescription for wellness, a prescription for lifestyle change. And the truth is that if you are not looking at your lifestyle and your habits and you want to take a medication, it is going to be short-lived. Injectables, pills, whatever they may be, if you're not using them as a tool to help you to make those changes and to be more effective with your weight loss, you will probably be back to where you started in the long run. Whether it takes you a couple of months to gain the weight back or a couple of years, ultimately, what we should be doing and what we can help you here at New Pathway Healthcare and Wellness do is understand how to make those lifestyle changes, make them in small steps, and make it manageable, make it doable. I tell patients all the time, listen, we're not going to upheave your entire life all in one session. But what we are going to do is make one small change, stick with it, and we're going to keep adding to that.
You mean eat your broccoli?
There you go. There you go. And so, and so the truth is that, it takes time, but you have to be deliberate when it comes to making lifestyle changes. And you have to be progressive in adding and stacking those changes until you really do make a complete turn, a complete about face, a complete change. But it takes time. And we are here to help you do that. There are tools. There are, ways in which we can counsel for the stages of change, because the truth is not everyone is ready to change, whether it's your diet or whether it's smoking or whether it's other unhealthy habits. People need to be ready for change in order for it to be effective. And so we assess your stage of change and figure out, where are you? Are you ready for that? And we are there to support you in that journey. And no judgment. It's because the truth is, like I said, it's a chronic condition that should be managed when it comes to obesity. And our wellness and making lifestyle changes is something that takes time. But if you're in it for the long game, we are here to support you and to help you each step of the way.
Speaking of the change, Dr. Fletcher, we are also seeing more information in the public square about menopause. I would argue that men are becoming more familiar with this issue because women are speaking up about it, whether it may start with baby roll the window down, because yes, we've gone from the phrase that I heard when I was a child, which was she was having her own personal summer, to the real facts about what it entails. And so from your practice and your experience, what are some of the more common issues that can be addressed? Because not every patient has the same kind of symptoms regarding menopause as the next.
It is different for every woman, and we do have different symptoms. There are an array of symptoms. And from the patient I have actually encountered lately is sleep. They have a lot of sleep disturbance due to the hot flashes. They don't sleep. The weight gain that they have also, and also the libido. They don't want to do anything in the bedroom. And for the patient that I have, the wife and the husband, I have a few of those, and I feel men out there, they're not getting any. So that's something that we women, we have to start working on. It creeps on you very slowly as You may kind of notice your hair is like thinning out a little bit. You don't want to give your men a little bit as much to you used to. You still want it, you don't want it. Kind of like pay a little bit more attention to that. When you start having hot flashes at night, you're not sleeping, you tend to have a little bit of more of mood swings. So depending on where you are, I usually encourage my patients, there's different things that we could do. A lot of lifestyle changes. To tell you the truth, women who are thinner don't get as many symptoms as women that are a little bit heavier when they go through menopause. So what you eat also, if you change a little bit of change in your diet, you may not have as much as many hot flashes. So there's a lot of changes we can do. There's medication also we can use, but it does affect the whole house when a woman is going through menopause, and it takes years to go through it. So there's a lot we can do to help them out.
And mood swings obviously may accompany that in some cases as well, I'm sure. I only have about a minute or so left, but Dr. Florence, I'll let you just kind of sum up your thoughts about women's health and the message that you want them to have moving forward.
Thank you for that. And first of all, I just want to say I've enjoyed our time together. I count you a bold man going where men don't usually want to go and talk about women and women's health issues and menopause. But yes, it's been a wonderful conversation. And I agree, what Dr. Fletcher said. It's a time of transition where there are many things going on. And I think hot flashes kind of get that popular thing, but believe it or not, there are so many other symptoms of menopause that are like the brain fog and anxiety, depression, our emotional health and wellness. I mean, mood swings is an understatement. Can we be honest?
Oh, yes.
I can be honest and say, like just sheer rage and anger. Sometimes it's just like out of control, right? Yes. I'm talking about what we see and
look at him.
Listen to his face. He said, I can agree, but he said, I'm not going to say nothing because I'm not going to be crucified. She's a woman. She can say that, and I will.
I'm not saying anything. but
the truth is, this is such an important topic. And here at New Pathway Healthcare and Wellness, we really do prioritize taking great care of women and helping them through this difficult transition in life and understanding that menopause is not just, one thing or one moment. It really is, there's perimenopause, menopause, and then postmenopause. And after, that you really don't go out of menopause, right? This is not like a moment. It's what life becomes, thereafter. And so having the ability to take great care of yourself. And not only that, understanding that can come with a lot of changes, body changes, and so on and so forth. So what do we want to do? We want to focus on ways that we can feel beautiful, both inside and out. And that's what we're here to do.
I think that's a perfect place to end this conversation. Dr. Chantel Fletcher, Dr. Nancy Florence-Swa. Also, we want to thank Mr. Owen Gardner, all of you, for taking the time to talk to us. I really appreciate it.
Thank you so much.
Thank
you for having us. Thank you.
That is the Daily Drum for this Monday, April 28th.